or someone you care about may have been diagnosed with lung cancer. This video will help you understand more about lung cancer and how it affects your body. Your lungs are a pair of organs inside your chest that allow you to breathe. You inhale oxygen, which all cells need. Then you exhale the waste gas called carbon dioxide. This gas exchange happens inside tiny air sacs in your lungs. Lung cancer is a disease which normal lung cells change into harmful abnormal cells called cancer cells. Cancer cells multiply to form clusters called tumors. These tumors grow and destroy healthy lung tissue. Lung cancer may spread to other body through blood or lymph fluid and natural substance that helps gather the unwanted waste material from your body.
In all cases of cancer, there will be called the classification of this. So we tackle about the lung cancer. In this part, I will be discuss about the classification of lung cancer. So there are two main types of lung cancer, which is the SCLC, the small cell lung cancer, and NSCLC, non-small cell lung cancer. A third less common type of lung cancer called carcinoid. So as you can see here, the two main types of lung cancer. To the right side is the small cell lung cancer, and to the left side is the non-small cell lung cancer parts. So what is small cell cancer? There are two types of small cell lung cancer, which is the small cell carcinoma and mixed small cell or large cell cancer. The types of small cell lung cancer are named for the kind of cells found look when viewed under microscope. Small cell lung cancer is almost always associated with cigarette smoking. So as non-small cell lung cancer is more common. So it makes up about 80% of lung cancer cases. And this type of cancer usually grows and spread to others other part of the body and more slowly than small cell lung cancer does. So there are three different types of NSCLC, which is the non-small cell lung cancer. So first is the adenocarcinoma, a form of NSCLC often found in an outer area of the lungs, and it develops in the cells of epithelial tissues, which line the cavities and surfaces of the body and form glands. Second is for the squamous cell carcinoma, a form of non-small cell lung cancer, usually found in the center of the lung, next to an air tube or what we call the bronchus. And lastly is the large cell carcinoma. It is a form of NSCLC, which
Stages of lung cancer. Non-small cell lung cancer is divided into four stages. Stage 1, cancer has not metastasized. Stage 2, cancer is detected in the lung and surrounding lymph nodes. Stage 3, cancer has metastasized in the lymph nodes and lungs. Cancer has metastasized in the lymph nodes only on the side where cancer cells first proliferate. Cancer has progressed to other lymph nodes, and in the stage 4, cancer has metastasized to the other distant or.
The most common signs of lung cancer are a chronic cough that does not go away, a very infectious one that comes from smoking, coughing up bloody spit or mucus like you have TB, chest pain or discomfort that worsens with laughing, deep breaths or coughing when you run fast. It aches here on your chest. When you do errands, you start to have deep breaths but hardly you can because of chest pain. You have hoarse voice because your body system is giving up because of lung cancer. You have loss of appetite. You don't crave for food anymore. Even when you are hungry, you likely choose to vomit. Having unexplained weight loss because you lost your appetite on food. You feel like you don't have energy to be alive anymore. You have shortness of breath. You have fatigue and weakness. You seem to suffer from restlessness and you can't rest enough. You are having lung infections that don't go away or keep coming back. For example, bronchitis or pneumonia. Wheezing or having difficulty breathing. You have difficulty swallowing food, swelling in veins of face or neck. So remember, if you have these such symptoms, please go to the doctor and have a checkup because prevention is better than cure.
Risk factors. A number of factors may increase your risk of lung cancer. Some risk factors can be controlled, for instance, by quit smoking, and other factors can be controlled, such as your family history. Risk factors for lung cancer include smoking. Your risk of lung cancer increases with the number of cigarettes you smoke each day and the number of cigarettes you have smoked. Quitting at any age can significantly lower your risk of developing lung cancer. Exposure to secondhand smoke. Even if you don't smoke, your risk of lung cancer increases if you're exposed to secondhand smoke. Previous radiation therapy. If you've undergone radiation therapy to the chest for another type of cancer, you may have increased risk of developing lung cancer. Exposure to radon gas. Radon is produced by natural breakdown of uranium, soil, rock, and water that eventually become part of the air you breathe. Unsafe levels of radon can accumulate in any building, including homes. Exposure of asbestos and other carcinogens. Workplace exposure to asbestos and other substances for known to cause cancer, such as arsenic, chromium, and nickel can increase your risk of developing lung cancer, especially if you're a smoker. Family history of lung cancer. People with a parent, sibling, or child with lung cancer have an increased risk of the disease.
I'll be discussing the diagnostic procedure, the treatment, and management of lung cancer. So there are four diagnostic procedures, in which these are the chest X-ray, CT scans, sputum cytology, biopsy. And under biopsy, we have three types of biopsy that could be performed. So first is chest X-ray. So this is the image of a patient having a lung cancer, and also the normal chest X-ray. So chest X-ray, it detects the normal or abnormal masses in the lungs. So as we can see, the lung cancer patient, in his left part of his or her lung, it's really different from the normal chest X-ray. Next, CT scan. So in CT scan detects tumors that missed by chest X-ray because it is more detailed than the chest X-ray. So as we can see, the normal chest of a patient and the chest with a right lung cancer. Next is sputum cytology. So sputum cytology is just a collection of sputum in which it is examined under a microscope to see or to look for a cancer cells. As we can see this under a microscope, so this is an indication that the patient have a lung cancer. So the collection of this must be collected first thing in the morning, before breakfast, because at least wala siya residue, like what we eat, maapil siya o luwa sa patient. So muna siya first thing in the morning before the patient take his or her breakfast. Biopsy. Under biopsy, we have three. So biopsy, it is collecting a sample of a lung cell to determine if it is positive to lung cancer or not. So we have three types: the bronchoscopy, mediastinoscopy, and needle biopsy. So bronchoscopy, it is a long inserted thin tube from the nostril down to the throat and into the lungs. While the mediastinoscopy, it is more likely sa may clavicle dire siya lapita. Ang insertion sa tool, it will be inserted in the middle neck and then directly goes to the lungs to collect a sample. Then the needle biopsy, it is a way of collecting a sample directly inserted through the chest wall, and then molusot siya sa lungs and then collect a sample. These three ways in collecting sample in biopsy, still an order from the doctor yapon. We will follow if the doctor will ask the bronchoscopy ang pagkuha sa sample, or needle biopsy, or the mediastinoscopy. Next, I'll be discussing the treatment. The treatment of lung cancer patient should be thoroughly discussed between doctor and patient, and also some other treatment is costly. Mahal to siya. So in severe cases, a patient might undergo surgery, in which these four types that can be done. So first is the segmentomy or wedge resection. Just a part of a lobe is removed, while the segmental resection is a larger portion, but still not the entire lobe is removed. while the lobectomy, it is the entire lobe of one lung is removed. So for example, the right lung has 3 lobes na. So the left lung has 2. Entire lobe raman. Naaraga po ang isa ka lung. Next is gynectomy. The entire lung is removed na siya. Next is chemotherapy, radiation, immunotherapy, and drug therapy. So the difference between chemotherapy and immunotherapy is that chemotherapy acts directly on cancerous tumors, while immunotherapy treats the patient by acting on their immune system, in which immunotherapy can boost the immune response in the body as well as to teach the immune system on how to identify and destroy cancer cells. Then next, we could also, a patient could also undergo palliative care, like a specified treatment that can relieve the shortness of breath of the patient. Then alternative medicine, yoga for relaxation, massage, meditation, and also acupuncture.
Answer number 1: deficient knowledge related to lack of information about the condition secondary to lung cancer, as evidenced by agitation, verbalization, or of concern or worry for follow through on instructions and frequent request of information. So the goal is we need a patient to verbalize understanding of condition, treatment, diagnosis, prognosis, and probable complications. So as a nurse, we need to provide information to the patient about diagnosis, prognosis, treatment, length of therapy, possible complications, and expected outcomes. Because the patient has the right to know about their care plan and treatment alternatives. By providing them base knowledge and awareness, will help them make an informed decision, most especially when they need radiologic intervention or chemotherapy. Number 2: anxiety or fear related to change in health status secondary to lung cancer, as evidenced by apprehension, increased pain, insomnia withdrawal, and denial. So the goal is we will make the patient effectively acknowledge his or her fear and will demonstrate effective coping strategies. So as a nurse, we need to assess the patient, his or her family members or significant other understanding of the condition. Assessing the patient and her SO's level of understanding enable the development of individualized care plan. By assessing their level of awareness of the disease state, their knowledge base will change over time, influencing their decisions and expectations, and so adjustment to care plan can be made. Diagnosis number 3: impaired gas exchange related to lung tissue removal, secondary to lung cancer, as evidenced by dyspnea, cyanosis, restlessness, and hypoxemia. So our goal is to make the patient demonstrate the absence of respiratory distress with improved ventilation and oxygenation. As a nurse, we need to evaluate the patient's rate, rhythm, and depth of respiration. Observe chest movements, burst lip breathing, use of accessory muscles, and changes in skin color. We need to note for pallor, cyanosis, and color. To establish a baseline set of observations and address difficulties in breathing, initial observation of increased respirations may indicate the body's compensatory response for the loss of lung tissue. Meanwhile, increased respiratory effort and peripheral cyanosis may suggest in an increased energy consumption, oxygen intake, and reduced respiratory reserve. Diagnosis number 4, acute pain related to tissue trauma secondary to lung cancer as evidenced based by reports of pain, discomfort, restlessness, withdrawal, changes in blood pressure, and respiratory rate. The goal is to make the patient report pain relief and demonstrate effective strategies to elevate his or her pain. Our intervention is to take note of the patient's verbal and non-verbal indications of pain because the disparity between verbal and non-verbal cues can reveal information about the severity of pain, the need for intervention, the efficacy of the program. Number 5, ineffective airway clearance related to chest movement secondary to lung cancer as evidenced by dyspnea, effective coughing, presence of abnormal breath sounds, and change in respiration. Our goal is to make the patient demonstrate patent airway and effective expectoration with absent abnormal breath sounds. One of our interventions is to perform auscultation of the lungs and listen for the presence of secretions and nature of breath sounds because impaired airway clearance are evidenced by wheezing, noisy breathing, and bronchi. Lung cancer is by far leading cause of cancer death, making up almost 25% of all cancer deaths. Make each year more people die of lung cancer than any other cancer caused death combined. About 80 to 90% survival rate, but take note for early stage a survival rate for severe lung cancer is very least and expensive. I still like to instill in everyone's mind that prevention is better than cure. So to prevent lung cancer, you need to smoking cessation, vitamin taking like vitamin E, A, and C, routine screening, precaution with environmental exposure to carcinogens. Remember,
Remember that lung cancer is a deadly illness when it reaches its terminal stage. So you should prevent yourself because prevention is better than cure, and that always put hopes up and believe in God and trust fate. You might suffer from this illness and you might feel in despair, but always think that you are not alone. You have the family and you have God. Thank you for